I was in ICU for about 5 days, waking up in ICU, and all I could hear were the beeping of the machine. And I woke up not knowing where I was. I saw a nurse come to me, ask me if I knew where I was, did I know what was going on. I had no clue what was going on at that time, but I felt like I had been hit by a truck. Hi everyone, and welcome back to Tammy and Grace. Thank you for joining me. On today, we're going to discuss the topics of symptoms, my actual transplant journey, and the things that you can expect to go through pre and post transplant. So the first thing I want to talk about are the symptoms. The symptoms that I suffered with were fatigue, extreme fatigue. There were some days where I literally could not get out of bed. Another major thing was confusion. Prior to me actually going to the emergency room, while I was still working, there would be days where I would just be utterly confused. My boss and my colleagues would come to me and ask me to do things for work, or I would do certain things at work, and I literally could not remember doing them at all. The other thing was nausea and vomiting. Those two things were some of the major factors that got me to have my husband to take me to the emergency room that night. I could not keep anything down for days. I also experienced some pain in my side and dark urine. So it was all of those things were most of the symptoms that I experienced. But one of the reasons why I had not gone to the emergency room, I had just had my daughter. So I thought some of those things were postpartum and that they would just pass. But literally the day when I did not have any energy to get out of bed, just to walk from my bed to the restroom, I knew that something was really, really wrong that day. And that was the day that I had my husband take me to the emergency room. From there, I'm told that I was admitted into the hospital in the city of Macon where we live. And I was admitted, and they began to just run tests to see exactly what my issues were. My numbers were off in the emergency room, which was why they went ahead and admitted me. While in Macon, I was in a regular room. They were just running tests for several days at a time. They knew that there was something wrong with my liver, but they had no clue exactly what. While in the hospital is when I developed hepatic encephalopathy. This is a condition where all of the toxins that your liver would normally filter out of your body, they began to pool in my body. Because my liver was not functioning properly, all of those toxins began to accumulate within my body. They traveled to my brain and to other parts of my body. And during this time, I was in and out of awareness. I began to sleep for like hours and days at a time. And this is when the doctors figured out that there was something extremely wrong. They did not know exactly what was wrong. And I think between my husband and the doctors here in Macon, the decision was made that I needed to go to Emory for further testing and for them to try and see exactly what was wrong with me. I'm told that from the drive from Macon all the way to Emory, my hepatic encephalopathy really, really kicked in at that point. And for those who are familiar with hepatic encephalopathy, you know that this is something that, oh my gosh, there are hardly any words to describe it. Confusion, forgetfulness, violent behavior. I'm told that yes, little old me became extremely combative, from refusing to take medications to assaulting a nurse, which I later apologized for. But it was hepatic encephalopathy causes you to just act completely out of character, out of mind, and to do things that you really ordinarily would not do, and you have no recollection or memory that you have done those things. And I looked really, really bad from some of the pictures that we have of me prior to transplant. While some you can see that how my skin had darkened, and that was because the toxins were backing up in my body. I felt like I literally looked like death. And once we got to Emory and the doctors ran all of the tests, they came back with the diagnosis of acute liver failure. The onset was sudden, and because I did not have a history, like I said, I did not drink, did not use a lot of different medications or drugs. They could not figure out exactly why my liver had failed. And so they categorized it as acute autoimmune liver failure. And what I'm told is that sometimes when families have autoimmune diseases, sometimes they can manifest themselves differently in different family members. So, for example, if you have a family member that may have lupus or rheumatoid arthritis or some of the other autoimmune diseases, it can manifest itself differently throughout your family. So that's something that you may want to be mindful of or look into if you have been categorized as someone who may have an autoimmune type of disease and you're sensing that and you're seeing from test results and doctor's appointments that your liver enzymes are off. That's something that you may want to look for. But to move on from my diagnosis, we were informed that there were a couple of things that the doctors tried to do. One of those things being the MARS machine. The MARS machine is a device, it's a machine used for dialysis of the liver. If you're familiar with dialysis for kidney patients, you know that kidney patients go in and they have dialysis and the kidneys are flushed. Well, this is the same thing that happens with the liver. The only thing with the MARS machine is liver patients who are using the MARS machine. This is not a long-term machine that you can be on. Unlike dialysis for kidney patients, with MARS you cannot. It's only for about a week. So the doctors tried this on several occasions and we became hopeful. We thought that it was working, my behavior would return back to normal, my speech would come back to normal, but then slowly after a few hours, my health would decline back and I'd be back in the state that I was previously. So after that did not work and other things, the doctors informed us that I would have to have a liver transplant and that I would need it immediately. Immediately, like I only had a few days to live. And if I had not received a liver transplant, they had told my family to start preparing for my funeral. It was a pretty grim diagnosis. My family is a praying family and a fasting family, and we do believe in the power of Christ. Through faith and prayer, we prayed and put our trust in God and the physicians to do what was best on my behalf. And with that being said, I was put at the top of the transplant list because my health was declining very, very rapidly. And in less than 24 hours, I received a miracle. My family was informed that they had a liver that was a possible match. The liver would be flown in from the West Coast, is what I was told. After the liver came to Emory, of course, there were lots of testing that was done on the organ. They test the organs for every possible disease, hepatitis, HIV, any type of blood diseases, anything that they can think of. They make sure that the liver is as healthy as it can be before they announce to the family, yes, we can move forward. My family was informed that the liver transplant was a go. The organ that we had received for possible donation and implantation, they told me that this liver was a perfectly healthy liver. And on February the 19th, 2016, I went into transplant surgery. I'm told that that surgery lasted about maybe 10 hours. Throughout transplant surgery, one of the things that happens is they take your family into this waiting room area and your family's given a phone. And That is their way of communicating with the surgeons and with the entire transplant team as the surgery is going on. They inform your family when the incision is made. They call them again when they've taken the diseased organ out. The call is made again when the healthy organ is put back in. Call is made when the incisions are made and you're sewn back up. They inform your family every step of the way. Now, going into surgery, your family is informed about every possible scenario that can go wrong, from heart attack to stroke, every possible thing that could go wrong. Your family is well informed throughout the entire process. Is it scary? Yes, it is. So after transplant is done, your family is notified that they have moved you from surgery into recovery. And after that, I was in ICU for about 5 days. After waking up in ICU, and all I could hear were the beeping of machines. And I would see little green specks on the machines. It was completely dark in the room. And I woke up not knowing where I was, what was going on. And then I saw a nurse come to me and ask me if I knew where I was, did I know what was going on? And of course I didn't. I was heavily sedated, y'all. I had no clue what was going on at that time, but I felt like I had been hit by a truck. And one of the things that they do now, they do give you good pain medication and the little button where you can push every time you need some meds. They do give you that. But I spent 5 days in ICU, as I said, and from ICU, they moved me to a regular room. And one thing about when they move you to a regular room with regular patients, they treat you like a regular patient. They don't waste any time. I think they may have given me 1 day just to rest and sulk when I was in a regular room, but after that, the next day, they were ready. The nurses were in and out doing blood work. I had to set up a meeting with the therapist, even though I had all these incisions going on. And y'all, I received 42 staples. I have what's called, they call my incision the Mercedes. It looks pretty much like a Mercedes symbol. Some people call it the peace symbol, but that peace symbol, oh my Jesus, 42 staples. And even though I had those 42 staples, it did not matter. The nurses were going to get you up out of bed. They wanted you to walk. You had to start physical therapy. Their goal was to get you up and moving as soon as possible. Now, one of my major issues was walking. And not everyone has this issue, but because of my severe condition, I probably had not walked and been on my feet in 3 weeks, maybe 4 weeks. My legs were literally weak. So I had a hard time walking. I started with a wheelchair and then I went to a walker. As a matter of fact, I was on my walker the entire time that I was in the hospital and for a few months after I got discharged. So during that time, my legs were never strong enough where I was able to walk on my own. But with therapy, we would have to do what were laps around our floor. And when I tell you that was some of the most excruciating pain during the laps with my therapist. But after you accomplish a full lap around your floor, you got to ring the little bell and they would celebrate with you. Other patients come out of the rooms, the nurses, the doctors, no matter who you were, when you heard that bell, everyone celebrated with you because that was a major milestone to be able to walk a lap around your floor after transplant. And it probably took me a few days of trying and failing and moping and getting back up and trying again. During that time, like I said, I was at Emory University in Atlanta, Georgia, and they are one of the best. They have one of the best transplant programs in the Southeast. The nurses were wonderful. I had nurses who were painting my nails, who were coming in, giving me everything that I needed. So meeting with the nurses every time medications were given, one of the things that you can expect, quizzes. Yes, I said quizzes. They want you to become as familiar with your medications as you possibly can be. So not only you have to know your medications, you have to know what they're used for. You need to know what they look like. You have to know your dosage. And in addition to you knowing this, your immediate caregiver has to know these things at all times. So when the nurses come in, when they're giving you your medications, you have to recite what it's for, what's your dosage, what it looks like. And when you get it wrong, they literally are upset about you getting it wrong, and you have to retake that quiz over and over and over and over and over again until you get it right. So medication consultations, consultations with the dietitians, what foods you can eat, healthy foods, what foods you should not eat. Now that I'm a transplant recipient, I can no longer have certain foods like pomegranate. I can no longer have foods like grapefruit. And y'all, I love ruby red grapefruit and ruby red grapefruit juice, but I can no longer have those things because of the interaction that it has with my anti-rejection medications. And we'll get into that later on when we start talking about medications. Again, so consultations with your nurses about medications, your therapist. Not only do you have physical therapy, but you have occupational therapy. One of the things that I found very, very difficult adjusting to is the fact that with the liver transplant, your incision, it severs all of your abdominal muscles. So literally you have no muscles to use, and you literally cannot bend over. You can't bend to the side. You literally have to stay straight, and you have to turn your entire body because you cannot risk popping a staple. So you risk popping those out, causing a tear, and bleeding. So there are certain things they have to teach you: how to get in and out of the bed, how to adjust yourself standing up and sitting down, how to take showers. I had to learn all of those things all over again, or a new way to do those things. Putting on shoes without bending over and using your abdominal muscles. You get very creative, but there were therapists who came in and taught that before I was able to be discharged. A week in the hospital after transplant, going through therapy, meeting with the dietitians and nurses and learning the medications, it was discharge day, what we called D-Day in our house amongst our family. Prior to discharge, I was assigned coordinator and a social worker. The coordinator that I was assigned to on that day, I still have those same coordinators. They're there as a support for you. Every now and then, based on the caseload, you may be reassigned another coordinator, but they try and keep you with your initial coordinator. And here I am 4 years later, and I've been working with the same women for the last 4 years. We've formed relationships. We've gotten to know each other, and they're there to help you with whatever you may need. You call them, and they're there for you to offer assistance. After discharge, you are required to stay in the area within the vicinity of wherever you received your transplant. So at Emory, we were required to stay within the Atlanta area. They had what was called Madison House. It is where transplant patients can stay, and their immediate caregiver. You are allowed, I think, one person to stay with you, but because we have a family, my husband and I have 2 small girls, and we have been separated from them, we were given special permission to stay up in the Atlanta area because we had family there. So I was not allowed to come back home because it was about 2 hours away from the transplant center. And one of the reasons why they want you to stay within that vicinity is if you have any issues with rejection, issues with medications, issues with bleeding, any type of issue, they want you to be able to get back to the hospital as soon as possible. So again, after about a week of therapy in the hospital and learning everything that there was to know about my new organ and about my new life, how I was going to exist after transplant, I was discharged and let go. So I know I covered a lot in this video, but I just wanted everyone to know the things that I went through during the actual stay at the hospital and immediately after my transplant. I hope I said something that was of value to you. If you have any questions, comments, be sure to leave a comment. Also, be sure to give me a thumbs up and like the content if you liked it. And don't forget to subscribe. We want you to subscribe to the channel. If you know someone who's pre-transplant or post-transplant and you think that this video may be of help to them, be sure to share it with them. Again, thank you and see you next time.